We know that the population that's extremely vulnerable when it comes to the spread of COVID-19 here in our facilities. So today we're going to discuss those approaches with all of you that can be used for updating your systems and assisting all staff to work as a team in a safe environment during the COVID-19 pandemic.
So policies and procedures are essential in order to provide all of our staff with the directions and expectations. So here is a list of some of the examples that can be used to educate as well as to observe for compliance during our process surveillance and audits. So each policy and procedure should be outlined with expectations from employees such as hand hygiene, PPE, resident rooms, step by step, including isolation rooms, any rooms where aerosol generating procedures are occurring, nebulizers, suctioning, sputum induction, also taking a look at surfaces, how we are cleaning and disinfecting those horizontal or what are we doing with carpeted surfaces, high touched areas, doorknobs, handrails, faucet handles, etc. Also taking a look at common areas, hallways, dining rooms, break rooms, and then having good procedures for terminal cleaning, schedules and assignments, also trash removal. And then we want to make sure with hand hygiene, we include directions for both soap and water as well as alcohol-based hand rub, and then chemical handling. And that includes the product we're using, the preparation instructions and directions, the proper labeling, and then safety. We're going to look at PPE, ventilation, special directions, and then with medical equipment cleaning and disinfecting. And that's going to be based upon the manufacturer's recommendations.
So during this pandemic, as Sue talked about earlier, it's really essential that on the COVID-19 unit that we're practicing with dedicated or consistent assignment as much as possible and do not have non-essential employees entering that COVID unit. So depending on the size of your unit and the number of COVID-19 residents, this may pose a challenge based upon current staffing situations and really your access to resources. So it's recommended that staff, even housekeeping or environmental services, are dedicated to the unit as much as possible, which is part of the strategy for reducing the spread of COVID-19. Now remember, if staff resources are challenged and you're not able to dedicate that consistent staff to that unit, you may want to consider that the nursing department is one that conducts and participates and utilizes and does cleaning and disinfection on the unit. If you're unable to do that, then it's important that you work with your housekeeping staff and your team that they go from working from negative to positive, meaning non-COVID-19 to COVID-19 positive unit, and not go back and forth. So working with their schedule and their assignments to make this happen is key for cleaning and disinfection protocols as we move forward here.
Policies and procedures for waste management, laundry, and food service will also need to be reviewed. But as you can see, good infection prevention and control principles in these areas will be sufficient for COVID-19. CDC guidance for healthcare facilities includes medical waste, trash coming from healthcare facilities treating COVID-19 patients is no different than waste coming from facilities without COVID-19 patients. CDC guidance states that management of laundry, food service utensils, medical waste should be performed in accordance with routine procedures. There is no evidence to suggest that facility waste needs any additional disinfection.
And when we're looking at our policies and procedures, we should also take into consideration comprehensive cleaning and disinfection for our visitation areas. Even if visitation is occurring outside, or outdoors, our cleaning and disinfection of these areas that come into contact with visitors or residents should be thoroughly cleaned and disinfected. So remember, we should also include in that disinfection protocol, the cleaning and disinfection protocol is the chairs, partitions, tables, under the table or the chair arms where individuals were seating, any items on the table, equipment. Again, it's recommended that we also have this duty assigned and resourced appropriately, as well as having all the products that are needed, accessible and available to the staff in order to complete cleaning and disinfection of this area. Make sure that your team is trained on how to clean and disinfect this visitation area is key for essential foundation and moving forward here.
For resident room surfaces, some of the strategies for cleaning and disinfection are the same strategies we've been using all along. So for example, we want to start with the surfaces that are the cleanest, top to bottom approach. Cleaning cloths should only be used in one room and never put soiled cleaning cloths back into the cleaning bucket. Mop heads need to be changed after each room, and we want to use caution to prevent our gowns from touching resident care items.
The CDC indicates in the interim infection prevention and control recommendations for healthcare personnel during the corona disease is that the pandemic, that a long-term care facility should use dedicated medical equipment whenever possible. If not possible, clean and disinfect prior to use with another resident. Always follow facility policies and procedures for cleaning and disinfection. As Sue indicated before, your policies and procedures should be updated for COVID-19, including the protocol for cleaning and disinfection with the appropriate products. Remember to first clean and then disinfect with EPA List N disinfectant. Follow the directions for safety. Check to see if the product requires to have a well ventilated area for use, and make sure that all staff follow the product directions for use, as well as the reconstitution product policies if required. And laundry, food service utensils, and medical waste, as Sue talked about before, can all be managed using routine procedures. So CMS in the COVID-19 focused survey for nursing homes also addresses cleaning and disinfection using the appropriate EPA registered product and reprocessing reusable resident medical equipment following manufacturer guidelines.
The director of nursing, housekeeping supervisor, administrator, infection preventionist, and building services leader together can work with your vendor to identify the proper cleaning and disinfecting products that are necessary when working with COVID-19. So for example, for COVID-19 or SARS-CoV-2, the EPA registered List N is the approved disinfectant list that should be used. If you go to the EPA website and click on List N, you will be able to search the list of registered products to choose from. It is also going to be essential that the facility chooses products from the list for proper disinfectants for other pathogens as well. For example, if you have residents with C. diff, you should be choosing List K for antimicrobial products effective against C. diff spores. Using the proper product will be essential in the spread of infection in your facility.
So Sue talked about is the EPA List N. Once you get to the web link for EPA List N, you will see the image that is on the left of your screen. The two areas outlined with arrows indicate an area to complete an advanced search option to find if the product that you're using meets the requirements in EPA List N. And it also, if you look at this area and click on the web link, it will also have an infographic on how to use the disinfectants safely and effectively. On the right, you can see another resource for consideration for you and your team. This is an excellent resource that you can download and use for any staff in any department that is cleaning or disinfecting any area in your organization. So quickly, as you look at this, it goes through a step-by-step guidance. First step looks at how you check your product to make sure that it meets the requirements. And then it tells you how you go to look at the EPA, the .gov, the List N requirements. Then the next step, it tells you to walk through and discusses how you read the directions. So you follow the product's directions, and then you check the use sites and surface types. Again, that is very important when we're looking at cleaning and disinfection, that the product is being utilized with the appropriate use sites and surface types. And you also want to see the precautionary statements as well on the products. And that should be part of your education process as well. Step 3, you need to pre-clean the surface. We know about cleaning versus disinfection. So pre-clean the surface, make sure you wash the surface with soap and water if the direction mentions that you have to pre-clean the surface or if the surface is visibly dirty. Step 4, we know, is follow that contact time. It's very important that our team members know the appropriate contact time for the products that we're using in our organization. So you find the appropriate contact time in the directions on the product, and the surface should remain wet with the whole time to ensure that the product is effective. Step 5, of course, is wearing your gloves and washing your hands using the appropriate PPE. And again, following the requirements as we see here on the slide. And of course, step 6 is always lock it up, keeping the lids tightly closed and store out of reach in case, and making sure it's out of reach in the appropriate areas per your policies.
So employee education is another aspect that is just so crucial when it comes to the prevention of the spread with cleaning and disinfection. So PPE is dependent, of course, upon the transmission-based precaution. So if they're cleaning and disinfecting rooms in the COVID-19 positive unit, full PPE must be donned. PPE is necessary and also dependent upon the type of cleaning and safety recommendations from the product manufacturer. Next is product choice and preparation. Preparation, education of the staff must be done in accordance with the product directions with no exceptions. Staff can be asked at the end of the education, do you understand EPA List N against COVID-19? Do you know how to use a disinfectant? Do you know how to dilute? Are you labeling correctly? Can the disinfectant be used on all surfaces or items? Are you aware of safety with disinfectant use, such as ventilation required? Are you cleaning and disinfecting solutions that are mixed that should not be mixed? They must also understand that they need to follow the manufacturer's recommendation when they are cleaning and disinfecting any equipment. Also, cleaning supplies and equipment. We want to make sure that, again, they're using the proper disinfectant and supplies, and that needs to be included in education, along with multiple cleaning cloths for each room. Cleaning thoroughly first, then disinfecting, as Lisa indicated, and then the assignment component with education. This is a crucial component because if we don't specifically assign routine cleaning and disinfectant duties, then we may miss some of those duties. And when it comes to COVID-19, it is important to have dedicated staff to the COVID-19 units. So if for some reason you are unable to do this, prioritize to request nursing staff first, already dedicated to the unit to clean and disinfect, but they will need to be educated and ensure they are competent and have enough resource time to be able to do that. And if dedicated staff are not an option, they must first provide cleaning and disinfection services to the non-COVID unit. Next, your isolation for quarantine residents, followed by last, the COVID-19 positive unit. And then documentation in a facility system that document that cleaning and disinfecting the rooms were completed as assigned.
So Sue said the importance of, we talked about our policies and procedures. We talked about the importance of education and competency. Now we need to make sure that one of the processes is auditing and that surveillance. Auditing for cleaning and disinfections is really part of our process surveillance, the plan within our organization, and should be part of that overall plan for appropriate cleaning and disinfection. So the audits can include different types. It could be an audit on appropriate preparation of the product. It could be an audit on utilization of the appropriate products and their use of the products. It could be on making sure that staff are using the appropriate contact time and auditing that process. It could be an audit on PPE donning and doffing and proper sequencing as it relates to cleaning and disinfection. It could be an audit on the safety with chemicals, includes following proper directions and keeping chemicals out of reach of residents. Audits to determine if the staff are following procedures for room cleaning, mopping, high-touch areas, contact time, does not recontaminate disinfected areas, mop heads, cleaning cloths like Sue talked about, donning and doffing of PPE, hand hygiene can also be included in your audit process. So again, auditing your team will help identify opportunities for improvement and additional education, targeted education. So remember, even one break in practice could contribute to the spread of COVID-19 throughout your organization. So in summary, as we know, the environment can contribute to the spread of COVID-19 or most pathogens. Therefore, having a good system with policies and procedures that are constructed around best practice approach and guidance is essential. Cleaning is done first to remove any organic material, followed by disinfection to kill any disease-causing pathogens. Use the appropriate disinfectant for COVID-19. It is EPA List N that we talked about today. Clean the high-touch areas frequently. frequently. So that means your light switches, faucets, doorknobs. It could be remote controls, cell phones, telephones, bathrooms, and again, following your appropriate policies and procedures that have been updated in accordance to the current guidance.
All right, excellent. Thank you again, Lisa and Sue, for this wonderful presentation. And we are continuing to get some excellent questions. I want to ask a couple of live questions around cleaning and disinfection, and then we have a number of questions kind of getting back to the cohorting segment as well. So one question, this is from Lynn Farrell. Housekeepers cannot bring a cart in the room, so they park it at the doorway and they reach in reach in the obtain cleaning supplies. Sometimes we see a gowned housekeeping arm reach out into the hall while they're trying to obtain their mop or their broom, paper products, etc. Is there a way to work around this?
Well, I would recommend that they take their needed supplies into the room in order to be able to complete their cleaning and disinfections and plan and prepare in advance so that they're not coming in and out.
And part of that is the education process. In, education, as we know, we've had so much education on COVID-19 and ongoing education. And we talk about signs and symptoms. We talk a lot about PPE and cohorting and all the aspects of prevention strategies. Cleaning and disinfection needs to be in part of that ongoing education. And Sue and I, we've done a lot of work with organizations where, while it's great to do, the education that you're doing in services, or it could be, that in-person to, one-on-one education, we recommend also doing some skills checks or doing some little scenarios where they set up where they have to practice, because part of in these times, in these unprecedented times, we go back to our regular muscle movement or the way we did things in the past when we didn't have COVID in our buildings. And again, like Sue said, it's that re-education, redoing it over and over and over again. So it becomes a routine practice with our housekeeping staff and gathering those supplies before they go in, teaching them to methodically think about those supplies that they need, go into the room, conduct what they need to do, and then follow the appropriate sequencing as they exit out of the room.
Okay, thank you, Lisa. Here's a question from John Overtfeet. What about deliveries for residents, such as Amazon books or deliveries from relatives? Do we disinfect those, keep them for 3 days? Could you comment on that?
That's a good question. I don't see a problem with disinfecting the outer package and then opening it. I don't know that, and maybe that's not a question that I can really give you a definitive answer on how many hours for sure that COVID can live on a surface when it's being shipped, because there's so many different, is it a 1-day ship? Is it a 2? How long does the virus actually live on those surfaces? But I wouldn't see a problem with disinfecting the outer package and then having them open it and take out the contents inside.
And we are seeing organizations that they have a process for when shipments come in. There's a location that they come in, they have a cleaning and disinfection process. And again, it's aligned with what their local Department of Public Health, that they work with them on the discussions of how they receive packages and how they receive goods and services, goods coming into their organization. So again, I would work with your local Department of Public Health. Again, like to Sue's point, it's very difficult for us to determine how long something, the pathogen is living on inanimate objects. So again, have a good process in place. And I would, again, recommend working with the local Department of Public Health.